Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we're joined by Estela Mata, the President and CEO of Looms for Lupus, which is a nonprofit organization that provides lupus, fibromyalgia, mental health awareness, advocacy, and support to those living with these conditions, their loved ones, and caregivers. I really learned a lot from Estela and her family's story, how they started Looms for Lupus, and the importance of advocacy. We also had a really powerful conversation on finding hope, the impact of community, and raising awareness this Hispanic Heritage Month.
Yeah, I think Estela is fantastic. I've been to Washington, D.C., been to Capitol Hill with her. She's great, and I'm excited to have a listen.
Hi, Estela. Welcome to the Health Advocates.
Hi, how are you?
I'm good. How are you? Why don't you start off by introducing yourself to our listeners?
Hi, I'm Estela Mata. I'm a co-founder and president of Looms for Lupus, a nonprofit organization that provides advocacy, awareness, education, and support to those living with lupus and overlapping conditions like fibromyalgia and mental health. We support those living with these conditions, their loved ones, and caregivers. So I'm excited to be here today.
Yeah, we're so excited to talk to you, learn more about your story, your family's story, and the work that you do as part of Looms for Lupus. I guess maybe going back, can you talk to us about your connection to lupus and how you started sharing your and your family's story?
So it all started in 2009 when my sister Juana almost lost her life to lupus. She was not diagnosed until she was very chronically and critically ill. She was diagnosed in the emergency room, which very rarely happens. She had so many symptoms that she had been going through dating back to 2004, where she got diagnosed with an autoimmune condition, hypothyroidism, and then rheumatoid arthritis. And so when she went into the urgent care that day in 2009, her platelets were very, very low. So something was literally attacking her body. And now we know that it was lupus that was attacking her platelets. She was originally sent home because they told her, we're going to get routine labs, come back tomorrow, typical kind of like urgent care visit. But she insisted and persisted, and she was able to have the provider listen to her and get tests done that day. And because of that, she is alive today.
Yeah, it's remarkable how much advocating like that is part of the chronic illness story. I live with 2 chronic diseases, and I remember being in a similar position of like really having to speak up and fight for the care that I need. I'm wondering if you can talk about how you've advocated alongside your sister, how you've seen her advocate, just like what that's been like for you.
Like you said, Zoe, it is very difficult to sometimes get a diagnosis. And I think learning about your symptoms, tracking your symptoms, and most importantly, using your voice is very important. Gaslighting is completely real. So I could attest to that because my sister went through that. But about why we advocate, lupus is a complex autoimmune disease. It could attack literally anything in your body. It could attack your kidneys, your heart, your lungs, your brain, but it also can impact your daily life, right? It could impact your mental health, your physical health. And for me, being able to learn and share our story with my sister, we advocate here at the local level, at the federal level, at the state level. We want to share her story and we want to empower others to do the same. And that's why we started advocating, because we wanted to help others.
And what's it been like connecting with others in the community through advocacy?
Oh my goodness, it's been amazing. We're all like family. And this is one of the things that I always say. When we connect with the community, you feel heard, you feel seen. And that goes both ways. For us, we want people to see us and hear our stories and learn from them. And then we also get to do the same. We get to listen to their stories. We get to support them. And then we get to, even though we don't always have the answer, we don't always have every single resource, we can at least guide them to get the resources or the support that they need.
I totally agree with that. So much of the journey is just about feeling less alone and feeling in it together. And you're doing that within your family, with your sister, but also in the wider community community with Looms for Lupus. I have so much respect for all that you do. Maybe you could tell us about how you started Looms for Lupus.
With Looms for Lupus, we literally just started exactly the way I told you. My sister was diagnosed with lupus, and it was very difficult to see the challenges that she was facing. And we knew that it wasn't just going to impact her, right? It was impacting the whole family. And we wanted to be there for those people that were going through the same or similar situations like us. So it was actually two of my sisters and I. So we co-founded the organization. It was Araceli, my younger sister, who is a detective, and Juana, who lives with lupus, and myself. And so our parents taught us from a young age to always give back, to help others. So that's really what we wanted to do. It was an opportunity for us to kind of turn this condition into something positive, right? We can't change a lot of things, but the one thing that we can change is what we do moving forward. And that was going to be supporting others, learning with others, and engaging with the community so they can get a better understanding about what lupus is and get an earlier diagnosis, especially with lupus, because it does impact everyone differently, and it does impact our Hispanic Latino community.
And what kinds of things have you learned over the years from the community about, like maybe some common challenges that people with lupus face? You talked about time to diagnosis, so that's one. Maybe what are some others?
So people that live with lupus, face so many challenges, both physical and mental. And at Looms for Lupus, we offer support groups. We offer educational symposiums. Within those symposiums, we talk about disease management, tracking your symptoms, knowing your numbers, knowing what your normal is, and when to detect those flare-ups. Because with lupus, a lot of stress can trigger flares. We also educate and empower them on how to utilize stress management techniques. So basically, everything from beginning to end, from navigating their health care to learning about how to advocate for themselves and learning about potential treatment options.
That's amazing. And I know, Estela, we got introduced because you're working with some of my colleagues on awareness of clinical trials. And I was hoping that we can talk a little bit more about that, specifically your and your family's experience with clinical trials and your advice with kind of navigating something that can seem so intimidating.
As a patient myself and a caregiver to someone that lives with an autoimmune disease like lupus, it is important for us to not only learn about our conditions, how to help ourselves, but also to learn about current treatments and possible treatment options. And for us, possible treatment options are clinical trials, being able to participate and being able to get that opportunity to try a potential new treatment for a disease like lupus, to us is something like kind of like instilling hope in someone and saying, there is an opportunity for you to not only participate in something that can help you, but something that can help other and future generations.
I love that message about hope, especially because, like you mentioned, lupus impacts the whole body. So it really is like tremendous, hope and relief to finally find something that works. How have you felt hope in watching your sister's journey?
Actually, my mom's name is Hope in Spanish, Esperanza. So we've been living with hope all of our lives, right? We say that.
I love that.
One of the things that I saw from the beginning is my sister never lost hope. Even though lupus was impacting her, like I said, physically, but it was also impacting her emotionally, she started loom knitting. So it's a form of knitting, and she was using it as a coping mechanism to kind of feel a little bit better. Getting diagnosed with lupus, a chronic autoimmune disease that was impacting her daily life, was going to be a struggle that she was going to face. We knew there were no FDA-approved treatments back then. Now there are, but it still can impact everyone, completely different. So for me, seeing her that she had hope, even though she was dealing with all of this, gave me hope and inspiration to continue to learn about the condition, to figure out ways on how I can help her and just be there for her.
Yeah, you guys are lucky to have each other. And it's so funny you mentioned about the looming, because actually when I was in the hospital getting diagnosed with Crohn's disease, I remember feeling so antsy and scared and just needing to do something. And I started crocheting a lot. And it's funny how that, doing something with your hands, something tangible that you can have control of, it's such a part of the journey. When so much is out of your control, doing something simple and focused helps bring about that hope.
Yes. Oh my my goodness. I'm glad that you shared about you crocheting, because when you're feeling so helpless, you're feeling so overwhelmed, being focused in that little small accomplishments, right? Even if you get just one loop at a time, right? Like that's a huge accomplishment, and you're already focusing on something other than what you are going through and what you're struggling with. So, for us, when she started loom knitting, it was something that just kind of came in together because my mom crochets. In Mexico, that's something very traditional. My mom would crochet, my sister would loom knit. I cannot do either, but I tried. But, just being together and being there for one another, I think has helped us tremendously. And we do have a saying, and we say that we're continuing to knit a community of hope. We never want to change the name Looms for Lupus because that's how we started. Even though now we have expanded to other conditions and advocating and raising more awareness, just an overall, equitable healthcare access, we still want to do it one loop at a time.
Yeah, I was about to say, even if you may not physically be knitting, you totally are through the community aspect and providing support through every step of the journey, like you mentioned. And then actually, you just mentioned about other chronic conditions. Maybe you could talk to us a little bit about that, like why it's important to support lupus along with other chronic conditions and how you came to do that.
Raising awareness, not just for lupus, but just overall any chronic condition is very important because it impacts us all very differently. We need to be able to learn about these conditions, learn how to prevent them, learn how to navigate them, learn how to navigate, healthcare access, learn about treatment options. So I think that's with any chronic condition, we need to always be aware and continue to learn.
And, you touched on this lightly before, and I'd like to go into it more now, especially because it's Hispanic Heritage Month. But there's, of course, an added layer of health disparity when it comes to lupus in the Hispanic community. Can you, talk about what messages you have for the Hispanic Latinx community about the importance of raising awareness?
So raising awareness about health conditions that are impacting our Latino Hispanic community is crucial. It is crucial because, the more we learn, the more that we will reduce these health disparities. We will be able to hopefully get improved access to care, early diagnosis, and just basically just empowering individuals to get the support, to get the knowledge that they need.
Absolutely. Early diagnosis is so important. For one, you're obviously uncomfortable and need answers, but two, especially with a condition like lupus, you can have some pretty permanent damage in different areas of your body, right?
Yes, definitely. With lupus affects basically, it could impact your whole body. Like I said, physically and emotionally, it could impact your brain, it could impact your lungs, it could impact your kidneys. And a lot of the times it causes irreversible damage. And in many cases, my sister has been really lucky to be able to get preventative care and take action with her care team and preventing that irreversible damage. When lupus was attacking her kidneys, it could have caused her to lose her kidney function, to be in dialysis, and even potentially need an organ. So for us, prevention has been the key, and her proactive care has been really essential, and her advocating for herself and her taking charge of her health, really.
And what role do you think that advocacy and raising awareness plays in addressing the needs of chronic illness, especially in the Hispanic community?
Advocacy helps address the needs of the Hispanic communities by ensuring that we receive equitable health care. Everyone deserves to get equitable healthcare access, to getting culturally competent services, information in our languages. My mom only speaks Spanish, so the information that needs to get provided to her has to be in Spanish. It is also necessary for us to support everyone on how to manage their chronic conditions effectively, right? So raising awareness, reducing stigma, all of this will empower individuals to not only advocating for themselves, but advocating for their loved ones and the community as a whole.
And what's your advice for people who want to get started in advocacy and sharing their story or just get more involved?
One of the things that I always say is we all have a voice. We have a voice, so let's use it. Let's amplify our voices. Let's advocate for ourselves when we go to the provider's office, when we go to the physicians. Let's advocate for our communities. Let's advocate for better research. Let's advocate for better health care. Let's use our voice. And I think the more we utilize our voices together, the better it is amplified, and change comes with that. So if we need something, if we want change, we need to be able to speak on it and advocate.
Yeah, absolutely. There's like nothing more powerful than just sharing a story as a patient. I've spent some time advocating with elected officials, and their teams are really smart and can share with them the data all day long, but there's nothing like getting a personal story to really just say, we're real people living with chronic illness, and this is how the system, the laws impact us. So I would just say, like, to amplify what you said, that everyone has a story. You don't need to be an expert in healthcare to get started.
My sister says this, and it's so interesting that you said expert. My sister says that she's an expert in her body.
Yeah.
And I think we all are experts. So they may be the experts in policy making and running and help run the country. They work for us. So if we're the experts of our bodies and we know what we need, what better way to do this but then by sharing our stories, sharing our needs, and helping solve and create solutions for equitable healthcare access for everyone, right? So you're right. When we meet with the legislators, we can make an impact by sharing our personal journeys because they're people like us. They have families. They may be living with chronic conditions themselves or supporting someone that is. So you never know how impactful your story can be and how many lives it can touch.
It's true. Yeah, you never know like how closely people are connected. And I also think, there's something so special about when you share your story, it inspires others to do so. Like, just think about how you and your two sisters sitting down one time deciding to start Looms for Lupus and how much it's grown to inspire others to share as well. It's like really remarkable.
Yes. And one of the things for me too has always been about having people see us and see themselves in us. Because if there's a little Hispanic, Latino little girl that looks at me and sees that I look like her or that she looks up to me and says, you know what, I can do that. Maybe they could be doing much better in the future and they will get inspired. And that's why we do it. We just want to make sure that everyone's represented, that our communities are represented, and that we are heard. It's just one thing that we were raised to do. So we want to continue to kind of add that little layer of support for the community.
And I think that representation and advocacy that you're talking about is also such an important piece of the clinical trial discussion. To have that representation, we know there's been such a lack of diversity in clinical trials, and for you to be speaking on it, I'm sure encourages others from your community to feel a little bit more confident in making health decisions.
I think it's scary. I mean, just even our family members, they could be hesitant about trying new things, participating in clinical trials, be known as like you're a guinea pig or they're just going to use you. It's not about that. I think, education is key when it comes to, participating in clinical trials. We need to learn and understand what does it entail, the fact that it is optional, the fact that we are giving ourselves the opportunity to get a potential treatment that we may be the first ones to get, and it could be life-changing. And if it doesn't work for us, it could help others that are dealing with the conditions that we are. So to me, I just see it more like it's hopeful, but we do need more awareness. We need more education. We need to feel empowered. And the way we're going to do that is by getting as much information as we can.
Yeah, I think you make a really good point about the intersection of hope and information. Like, we really need to be equipped with good resources filled with information coming from experts in the field in order to feel that hope.
Yes, definitely. Through experts and also through patients, through others living with these conditions or going through it, right? A patient experience is so valuable. And I think it's so much needed because thinking about participating in a clinical trial, but I've never done it, it could be a little scary. It could be overwhelming to say, okay, I'm being committed to participating in a trial for X amount of time. I have to be going X amount of time or whatever the clinical trial requires me to do. It could be scary and overwhelming. But if I talk to someone that has gone through that same journey or is going through the similar journey, they can empower me and give me hope that I can do this, that I can participate and that I can make a difference. So yes, hope is definitely, I guess, the beacon of light that we need, right? To guide us through these dark tunnels that we go through and that boost that we need.
Yeah, I love that. Well, I guess I know you've given us so much much words of hope, but maybe for the last question, just any final thoughts of hope you want to share with the community for any listeners struggling right now, looking for a piece of that light.
One of the things my younger sister, Araceli, created for us was a little slogan. And I guess they do this, maybe when they're in academy or something like that. But she created a slogan that says, never give in, never give up, never let go, just keep fighting. So that's what I want to leave everyone with, that message. So not giving up, don't give up. If you are diagnosed with a chronic or autoimmune condition, it does not define who you are. It is just simply a part of your life. And just keep fighting for better treatments, keep fighting for everything, just keep fighting for yourself. And that's really how I want to leave it. Just never give in, never give up, never let go, just keep fighting.
That's beautiful. And yeah, I guess just know that we're also here. There's a community here fighting with you.
Yes, you are not alone. You are not alone in this life. Dealing with a chronic condition can be difficult, but we can do this together.
Absolutely. Well, Estela, thank you so much for joining us today.
Thank you, Zoe.
Wow, Zoe, that was a really great discussion with Estela. I normally ask for what you learned, but I'm going to start off by saying that I really learned a lot about clinical trials, and it was great to hear a deeper dive on the discussion of clinical trials and how it impacts patients.
Yeah, and also on that note, just really quickly for our listeners, we're launching a lot of resources about clinical trials, especially for lupus patients. So if you want to sign up for the newsletter, we'll leave a link in the show notes. And also from Estela, I just love the message of hope she left us with. It's so important to community build, and really appreciate all the work she does with Looms for Lupus.
Absolutely. Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.